Has anyone ever told you that you're iron deficient? Has anyone ever said to you in a pregnancy that you needed to take an iron tablet? Have you ever even heard of the term iron deficiency? This is something that comes up very frequently in pregnancy and a topic that people have many questions about. So today, let's talk about iron. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor, and today we're talking about iron. So as you know, I always start with expanding your knowledge. So iron is something that I really want you to have a little bit of a background about so that we can really then move into developing some skills surrounding iron and iron deficiency. So the first thing I wanted to do for expanding your knowledge, I want to go through quite a few questions because I think answering these questions is really going to build your knowledge surrounding the topic of iron and iron deficiency. So the first question that we want to ask is, what is anemia? So all of you probably that are watching, if you've ever been pregnant, you've had a CBC, which is a complete blood count. And now it's very simple to see the results of your labs because they show up on your portal. And sometimes you have access to your labs well before anyone calls you to review your results. So what I want to go through is what is considered the definition of anemia. And anemia can commonly be caused mainly by two things, these being the most common reasons. Now, there are clearly other reasons that cause anemia, but causes most commonly are from blood loss or iron deficiency. So that's why knowing the definition of anemia in and of itself is important. So since we try to break down things as simply as we can, how we're going to look at this is if your hemoglobin and or hematocrit is low. And this is one type of level to check your blood. Okay, so we're going to say blood levels are low. And sometimes people will just say blood levels in general, but we're going to specify hemoglobin and hematocrit. So when you're looking at this, if you're able to look at a CBC or your complete blood count, it looks at your hemoglobin and hematocrit and many other numbers. So we're going to focus on the hemoglobin and hematocrit. Now for pregnancy, the definition of anemia can be different than when individuals are non-pregnant. So I want you to know that we're talking about the definition of anemia during a pregnancy. So the hemoglobin and hematocrit being below a certain level is what makes the definition of anemia, okay? So for the first, second, and third trimester, these levels can be a little different. In fact, for the first and the third trimester, the levels for the cutoff of the definition of anemia are actually the same. So during the first or the third trimester, a hemoglobin less than 11, hematocrit less than 33, that is considered anemia. And then during the second trimester, a hemoglobin less than 10.5, a hematocrit less than 32. So those are the numbers that you're looking for to make the definition of anemia. And then to go even further, the question is, how do we know if the anemia is due to iron deficiency? From the CBC, which is the complete blood count, you can see a number that is labeled as an MCV, mean corpuscular volume. And if this number is below 80, that means that there is a microcytic anemia. That's how we classify it. And so if you have a microcytic anemia, one of the most common reasons for that is iron deficiency. And the way in which to check for it is to send iron studies. And then that's how you can know that you have a true iron deficiency anemia. Now, to take it one step further, of all the iron studies, the one that is the most sensitive and specific, meaning the one that is the best at screening for iron deficiency, is a ferritin level. And if your ferritin is below 30, you definitely have iron deficiency, okay? So you can put all of those things together when talking to your provider. But I wanted you to know a base answer of what is anemia, and then one step further as to what is iron deficiency anemia and how it is generally diagnosed. So it's actually very common to be iron deficient during a pregnancy, and individuals do require much more iron during pregnancy. In fact, you really should have a total of 1 gram of iron, of total iron more in your serum while you're pregnant. So your levels need to increase. And if you wonder how common it is very common to be iron deficient or have iron deficiency anemia during pregnancy. During the first trimester, it's approximately 7%. During the second trimester, approximately 14%. And during the third trimester, this is when it increases to about 30%. So very, very important, okay? It is higher in certain populations, so you might have a higher risk of it depending upon your nationality. So that's something important to know as well. Then we get into, well, how much iron do I actually need per day? And we're going to get into that with the developing skills portion. But the recommendation is to have an intake of 27 milligrams of iron per day. And again, that can be through diet or through supplements, but that's the total that you want to try to get per day. And generally speaking, the average diet has an intake of about 15 milligrams of iron per day. So most individuals are not going to get enough iron just from diet alone. And finally, the last question here, why do we care so much about iron deficiency in pregnancy? Well, there are some links that are made between iron deficiency and poor outcomes. One is going to be preterm labor. So we know that individuals who have iron deficiency do have a higher rate of preterm labor. Second is going to be low birth weight. So if we can try our best to prevent iron deficiency anemia, we're doing our part to try to prevent low birth weight in neonates. We also have an increased risk of perinatal mortality. So that means the risk of death around the time of delivery, and also the risk of death that could occur prenatally, meaning before the babies are born. And so when we say perinatal mortality, we know that iron deficiency has an increased risk of mortality around that time, prior to or right around the time of birth for babies. And then finally, there has been a small link associating iron deficiency with postpartum depression. And so again, these are things when we're answering and developing our skills as to why is it important to know about iron and the prevention of iron deficiency anemia. There are tons of positive outcomes that we can see if we do not have iron deficiency anemia in a pregnancy. All right, let's move on to developing some skills. So we did discuss that we want to have 27 milligrams of iron daily. Now, again, that can be from diet or supplements, but that's the total that you'd like to have for an intake per day. We also talked about the fact that people typically only get about 15 milligrams of elemental iron in their daily dietary intake. So with that being said, it is also now supported for individuals at their first prenatal visit to start taking a low-dose iron tablet. Now, you're probably taking a prenatal vitamin as well. It is still the recommendation at a first prenatal visit to start taking a daily iron tablet. And the reason is because that risk of iron deficiency, as we discussed before, is higher during pregnancy and continues to increase as each trimester comes about. So the risk is the highest in the third trimester. And when you're taking iron, it doesn't change immediately. It takes time for it to build up in the system. So that's why starting it as soon as possible is important so that you can build up those iron stores. Then the next thing as far as developing skills is trying to figure out the foods that contain iron. So if these are foods you don't like to eat, then you might need to supplement more than other individuals. But foods that are higher in iron are going to be seafoods. So clams, oysters, and shrimp. Also beef, turkey, beans, lentils, and there are some cereals that are fortified as well. Now, when you're taking an iron tablet, you may have read or someone had told you to take it on an empty stomach. Now, you can do that. However, it can make you a little bit nauseous. And so a lot of people do not like to take this pill on an empty stomach because it can lead to nausea. So I typically recommend individuals to take it with food so that they don't have that sensation of nausea. The other thing is you should take it with foods that help to absorb the iron, and those would be foods such as broccoli and citrus fruits. Now, there's also foods that you should not take iron with, specifically caffeine, as well as any types of soy or dairy products. That actually hinders the absorption of iron. So now that we know a little bit more about foods that you can eat and ways in which to take an iron tablet, the next question is, what type of iron tablet should you buy? And there's so many on the market. So what I'd like to put up on the screen for you here is a little bit of information around the types of iron and how much you will actually get from that type of iron. Now, there are tons of brands, and so none of this is information with regard to the brands that you'll see in the store, but it does give you the information of the actual iron. Okay, so on the screen, you can see different types of iron. So ferrous fumarate, you will get 106 milligrams of elemental iron per 325 milligrams. So that's one type of iron you can purchase. Another is ferrous sulfate, and you'll get 65 milligrams of elemental iron per 325 milligram tablet. And then finally, you have ferrous gluconate, which is 34 milligrams of elemental iron per 300 milligram tablet. So there's various ways to get that iron over the counter. You also can get a prescription from your provider for different amounts of iron depending upon what type they want you to take, or maybe if it's a better price through insurance or anything like that. So I talk with your provider about that. And be aware as well as you're learning more about iron and iron deficiency that if your levels are low enough, you might actually need IV iron. And if you're in that kind of a case, you have to talk to your provider about getting that set up to receive an iron infusion through the IV if that is indeed necessary. The last thing I want to talk to everybody about for developing skills is to make sure you talk with your provider about not only talking about the type of iron or some type of low-dose iron to begin taking at your first prenatal visit, but also about screening you for iron deficiency. This should happen at your first prenatal visit, starting with the CBC, the complete blood count, and going further from there if necessary. And then everyone should be screened again at approximately 24 to 28 weeks for iron deficiency anemia. And remember, you're starting with that CBC, the complete blood count, looking at your hemoglobin and hematocrit, as well as that MCV, the mean corpuscular volume. And if those things are of concern or abnormal, that could then prompt a further workup for iron deficiency anemia. All right, now we get into our impact. And this is a really big one for iron and iron deficiency anemia as a discussion because, as you learned earlier, individuals with iron deficiency anemia have higher risks in a pregnancy. Preterm deliveries, lower birth weights, also a possible link to postpartum depression, and then also perinatal mortality is increased. So think about the impact you can have, that if you're able to ask the right questions, purchase the right type of iron, make sure you're taking the right type of iron as early as possible in a pregnancy, the impact you're having is wanting to and hoping to decrease the risks that we mentioned of things like preterm labor, of things like a preterm delivery, of things like low birth weight, or even of postpartum depression. So what a positive impact we're having on trying to learn more about iron, as well as preventing iron deficiency anemia as best we can. Don't forget to check out your free download, drlexihill.com/advocate. And this has 13 questions you can ask your OB provider across the board so that you don't feel nervous about it and so that you can help to advocate for yourself. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.